2020, what is supposed to be perfect vision. But for the year 2020, nobody could have foreseen the pandemic striking, not even the people at the helm of any organization. My name is Dr. Masi Korir, and on this episode of Health Digest, we talk to 4 chief executive officers whose core business is health. Julius Kipngetich, Group CEO of Jubilee Holdings.
I was saying, in the event that I was hit, who then steps in?
Peter Munyasi, the General Manager, Sanofi East Africa.
We had a lot of energy and also very high expectations at the beginning of the year, but we didn't anticipate or imagine COVID and its impact in terms of our way of living. So things really turned to the worst when we had the first case of COVID around March announced in Kenya.
Dr. Tosif Dean, CEO, MP Shah Hospital.
It was a very turbulent time. We were not socially, mentally or financially prepared. We had decided 2020, with our budgets and strategy formulations, and everything was on course until when we heard the first case on 13th of March, and we were like, what next?
And Dr. Peter Kamunyo, the CEO of the National Hospital Insurance Fund, NHIF.
It indeed was a year of mixed fortunes, because I also saw the opportunity to apply for the job here at NHIF, which I did, and put all my energy to it, and I was a successful candidate.
Health business, hospital visitations dropped. I don't know whether it's out of fear or you can say people are visiting hospitals for frivolous things or things they can manage at home. Okay, but whatever the case, hospital visitation dropped, and then also the hospital environments were not good even for things which are elective, and we made provisions in our books that there were those possibilities coming to 2021, so our customers are fully covered. So from the health business, hospital visitation, we hope that people then have learned how to manage simple things at home using home remedies, so that then they can preserve their premiums for more difficult cases.
One of the biggest highlights actually for me in 2020, and could not have been made possible if it were not in the COVID times, was for the first time had an all-staff meeting, all staff across the country. We have 156 service points across the entire country, and everyone was in one meeting, and that we were able to do through a town hall, through Zoom.
All our board meetings were online, even our AGM was online. So everything, we followed the health protocols, I can say, to the letter, because then we even customers, whenever we had any customer issues, we would call the customer, we would do FaceTime with the customer, provide a Zoom link. So even the business development teams, as they were going out, we were telling them minimize going out, meet prospective customers online.
Immediately, these bosses had to think about the future. This was not just about the health of the business, but also the health of the employees, the engines of the business.
We entered into a replanning mode almost immediately, where we had to then refocus our budgets. We recast our budgets again, and then we said, and we toyed around with several scenarios.
We had already done some pre-planning because we had already heard about the infection in Wuhan. So we immediately formed our COVID task force, which was an extension of our Infection Prevention Control Committee. So we came up with a very robust committee with the administrative and clinical personnel, and we formulated many things together. For example, pre-screening tents, visitor restriction policies, isolation centers. We even have an isolation ward. So we did quite a number of things together, and it was basically a high alert situation. We had to even close many of our entry and exit points into the hospital because we have quite a number of them.
In pandemics, most medical insurers or third-party payers are not able to actually pay for it from the premiums that have been paid, because the risk modeling for a pandemic is almost impossible. But it is also a tool that can be used to be able to ensure that people still have access, because the infrastructure to ensure access is there. But there was another revelation, actually, that in times of need, because with the pandemic, it decimated most of the economic power of most people. So initially, the initial thoughts were people are not going to pay their premiums, etc. But the reverse actually occurred, because if everybody is not economically empowered, so our traditional way of getting support through harambes and chamas obviously would also go down. So it's making more sense for more people in these times of need to ensure that you have a valid and a working medical insurance through NHIF. And we actually noted after the initial dip an actual starting to climb, a rise in the number of enrollments, especially of the voluntary contributors.
Everyone had to stay in their home, so that was implemented even with our employees. But after a given period of time, we became very agile. We tried to find ways of trying to still work in the current conditions that had been set by the government. And that's why we embraced digital or virtual kind of engagement of our customers. So we deployed a lot of webinars. We deployed a lot of virtual kind of, let me call it remote kind of calls, where we interacted with doctors and continued the scientific dissemination of information to the doctors, even during that difficult moment when there was no movement of people freely around the country.
As they were thinking about the business, they needed to think of how to maneuver everyday life, from how to cope as individuals and in their families.
Since I got here, actually nowadays I get up in the morning at 4 to 4:30, and the first 1 to 2 hours are mine. I meditate. I do, now the gyms were closed, so do exercise on a mat in the house, and spend about an hour or so meditating, and that has gotten me in better mental health and to be able to handle, because indeed, like you said, this is a 24/7 commitment and job.
A lot of decisions had to be made at family level. My daughter was, for example, a candidate at A level, doing UK exams, but the exams were cancelled. And then they had to use a weighted average on previous years' examinations, and she didn't like the way it was done. Luckily, the UK government corrected it. And so there were a lot of things. My other daughter was doing online classes, and she didn't like it, because then you sit down the whole day, you're on the screen, and all these classes going on. So it was a very funny year, so to speak, because then everybody was panicking. And then, of course, the other fear was then me coming to the office was then the weakest link in the family, which is what kind of exposure am I giving them? And I always had to assure them every evening, I'm good. And I didn't expose myself. And I wore my mask, I sanitized, I keep one in the car, I keep in the office. When I reach home, I sanitize before I do anything else. So it was a routine that I had to learn, and also assure them that they are safe, because me, I am always out there. My wife worked throughout COVID period from home, even as a senior officer in another organization. So it was a lot of adjustment, both at family level and the workplace.
First of all, I think I'm blessed to have my children are fairly grown up. My firstborn daughter is 21. She's in university, and my secondborn is 16. So the challenges I'm having with them are now different challenges. They're teenage challenges. And it's interesting, because initially, because of diving in, and then you realize after some time that, hey, I've really not been seeing my wife, my kids for some time, because you live literally in the dark, you come back in the dark. So it is purposeful now to create some time, at least over the weekend, even during the short break, 2-3 break over New Year's, decided as opposed to even flying to a destination, is we take a drive so that we have more time in the vehicle to catch up and bond.
You had to really play that role, and you appreciate the role of teachers. It's not easy to be a teacher and a father and a mother at home. Also, the interesting part is working from home. The fact that you're on Zoom and maybe your son comes in and taps you on the back and he wants you to play and you're supposed to be very serious. Trying to just make your home an office and it's not just working. But the good thing is that we understood, and even within the organization, it was fair for people to really be a bit more relaxed at home and try to cope with the situation. I remember there was an incident in a Zoom meeting where we had a mother with a baby and still trying to catch up with the business proceedings, and it was quite interesting. So trying to get a balance from that was not easy, but a very exciting kind of experience.
COVID-19 was slowly teaching them that business was not all about money.
I think more than cash flows, Mercy, it was the safety of our employees. I think that was of paramount importance for me, that how do we keep safe? And by keeping safe, we are also keeping our patients and the patients' relatives safe. So I think to be able to create that environment of safety was crucial for us, because we did not want to begin an office contagion. And we were able to put in systems in place very quickly. But more than safety, also one of the key areas was training and education, because this was new for us. We didn't know what was coming forward. The correct use of PPEs, donning, doffing procedures, understanding the virus, the mutations, etc.
We also got into a mode of working where all our staff who had any chronic illnesses or were above a certain age, we allowed them to work home. And that was really to work from home. And that was also really great, because that was something that traditionally was not being done. And I can say that's another positive learning from COVID. And realize a lot of work can still be done remotely. And we enhanced and created systems to enable them to be able to work from home. At the same time is when we also introduced the digital platforms. So we started reducing the footfall of the public coming into the building. And then also got certain teams to start working in shifts. It's also around the same time that we enhanced our customer service center, whereby in up to about April was handling just about 200 calls a day, to now where it's handling way over 3,000 calls a day.
Our challenge was the implications for our medical scheme. That was my first worry, was what impact could it have on the business, the medical schemes, because then if we had a large population of our customers being hit by COVID, what would we do? And we tore it around with some scenarios. The other one was group life. In the event of death, then we have to pay, the benefits. And then we started asking ourselves, which employees are in the vulnerable category? So we also looked at that. And then we also said, how will we protect our relatives, the relatives of employees? If an employee got hit and we have older parents, how will we? So it defined a lot of our messaging, because even up to today, we still give messaging to staff daily. Initially, we used to do it twice a day.
The biggest worry that we had was about the health of our employees and also the people in general, because we know the devastating kind of effect that COVID has. We've witnessed the loss of life and also admission in hospitals. And that was the biggest worry that we had. Of course, we had other subsequent worries. That was the business, because we are not able to operate optimally. So that had an impact on the business. We also had a big worry, which I think is still persistent at the moment, because these were some of the consequences of the COVID-19, where the economy was took a hit, actually a significant decline in the economy. The projection for the growth of the economy was about 6%, but during the COVID period, actually they revised it to about 1%, and it really affected the standard of living of very many people.
Just like countries were warned to expect the first case of COVID-19 anytime, so did the businesses. But when it struck, it was still an uncertain time.
The first time there was a report, there was shock in the organization. But I'm glad to report that the effect has been minimal in Jubilee. We have had a total of 15 staff in all the 5 countries that we operate in. Only 15 staff were affected, and all of them have recovered. Okay, so, but the first case shook the organization because then it was like, okay, who came into contact? Okay, and you know, contact tracing was still new at the time, and it's like, okay, some people were thinking it's a death sentence. You know, I touched somewhere, but we have learned since then that if you just follow the protocols, your safety is almost assured.
My thoughts were, what can we do to make sure that we are able to contain it? So it was a mixed feeling when I got the news, and I knew that we are in for quite a bumpy ride. The period when we were doing our biometric training across the country, a couple of our staff actually did get exposed, but they were treated, and they recovered. And at that time is when we also enhanced the measures internally by, you know, thorough fumigation of all our buildings, and ensuring that a communique actually sent out a communique to staff that if you feel any symptoms, you inform your line supervisor, stay from home and monitor, as we promote ensuring that we don't expose the rest of the staff.
We were very prepared. We knew what we had to do, and the necessary measures were taken, and we admitted our staff, we treated our staff, and I'm happy to report that the staff was also repatriated in excellent health. Of course, as every human, there was worry, there was fear that we should be able to look after our staff who has devoted most of their time in a frontline capacity to the institution. So we left no stone unturned, and some of our staff were even critical. So we took every measure that was possible to be able to treat her.
It was a big surprise, but the good thing is that we prepared ourselves as an organization. During the COVID-19 onset, we set up a continuous kind of communication strategy within the organization. We had weekly kind of catch-ups, and we sensitized people on COVID and a possible kind of maybe exposure and how to prevent or protect yourself in line with the government guidelines. We had incidents, very few incidences of COVID-19 within our organization. The good news is that they all recovered, so we didn't have any kind of dire consequences of it.
As the team leaders, a lot lay on their shoulders, and the least that was expected was for them to talk to staff and show leadership.
I had been following it when it landed in Europe, especially Italy, because Italy had been hit so badly by the virus that it gave us a snapshot of what it is. I also read what had happened in South Korea and UK. We knew that's the importance of preparation. We knew that the dawa for this challenge is communication. If you communicate to people consistently, truthfully, they will then know that whatever management is saying, it is for our own good. So even when the first case hit, we communicated to staff, okay? But we were spreading facts, not fear.
Being in the healthcare industry and having been exposed to many of our members also having been infected, we were psychologically prepared. I know many people, it's an instant panic. Yeah, but we were psychologically prepared, and we had already set up a team that we call a COVID team, internal core team, to be able to manage the welfare of staff. So the communication was swift. The reaction of management to support them was also swift. And even subsequently, we knew how to manage that. And that is why, following that, the communication that anyone who feels they have symptoms to first stay away until the confirmation. So we were able to manage that, but I think it's because we had the cheat sheet also of how to go about it.
I think one of the first things that we did was communication. Communication was at every point. I, as a CEO, was giving daily, literally daily updates to the staff, for the first 6 to 8 months of the pandemic, and now up for about a month. Every month we are giving updates. So I think communication was key. Staff were not left guessing that what are we planning to do. At every stage we were communicating through WhatsApp messages, through our emails, through phone calls, and we were in constant communication with each and every member of staff through departmental heads to tell them what we're doing as an institution, where we need their support, and we were also opening up forums for them. And I think one of the best things that we've done as an institution is to create employee support groups. And these groups are formalized by the head of nursing and various other heads of departments for staff to come and raise concerns. And I think one of the major concerns that we had as an institution was, how do we have staff in excellent mental health during this period? And that, I think, was one of our major challenges. But we have actually been very successful with that. People have come and they're open about it. I think you, more than anyone, is aware how mental health is a very big stigma in Kenya and even many parts of the African continent.
When the disease came, that a lot of our employees were going to work outside the office, and we prepared ourselves. Okay, we understood how many employees will require devices, and we bought some of them in advance. So when the disease hit, we were able to deploy very quickly. For example, our health business. So the medical team, 95% work from outside the office. When we were able to deploy very fast without affecting customer service. I don't think even up to today the customers know that 95% of the healthcare business staff, yes, that most of them are actually away, they are working from home.
We always work as a team and we always see each other. So that personal touch was something that was a big concern for me because it really plays a key role in terms of motivation, in terms of teamwork, in terms of a positive spirit at work. But now people working at home far from each other, that was missed significantly, and that was my big concern. So what we did as a team is we became very creative. We had sessions whereby we would link up virtually and have very interesting sessions called Kahoot, where we'll have games and, just try to keep each other motivated and, keep working during that very difficult moment.
I think communication is very important, and how you engage your stakeholders in light of a pandemic similar to COVID. So there are a lot of lessons to be learned.
The year was a bag of many things, mixed feelings, anxiety, and at times, heartbreaks.
The greatest disappointment for me for COVID was there was no global leadership to respond to the pandemic. I had expected America to provide that global leadership. Of course, Trump was there and he failed. So we expected a much better coordinated response at the global level. Okay? Unfortunately, the country that then was supposed to provide that leadership was hit most by COVID, because they are 4% of the world population, but a quarter of the COVID cases. It's a very strange phenomenon, and the mortality is much higher there than anywhere else in the world.
What broke my heart and was actually the fact that as NHIF being poised to help the Kenyans, especially those who are in most need, that there are people who are calculating to defraud the fund and deny other Kenyans the benefit. And that, to me, has been the most disappointing, that you find that there are certain individuals who calculate to commit medical fraud through fake claims, through impersonation, through claiming more than has actually services that have been given. And because of that, I actually took it upon myself to make sure that we enhance our team to be able to detect this fraud, because the one that we've detected, and we know that it's just the tip of the iceberg, is very disappointing. And that was, I think, my lowest moment, actually, to realize that the scale of that fraud is actually very big.
So it's not fair to maybe point fingers, but I would say one of the most depressing and the most heartbreaking situation that COVID presented us, besides the impact on health, the impact on the economy, was the fact that, you know, it disrupted our way of life. Our children were not able to go to school for quite a long period of time. And just managing these children at home, there's a lot of challenges. We had psychological kind of effects on some of the children, of course. We also had incidences whereby, idling around. I mean, it's so difficult for the parents managing the children. I think that was really heartbreaking. I'm really happy that schools are now opening, and hopefully at least we'll learn how to live with the current situation, safely of course, but at least trying to balance with our normal way of life.
Businesses were making tough choices, and some of them were whether to implement pay cuts or lay off staff altogether.
One of the biggest challenge that any leadership or any person in leadership position will face when you have to make a decision around maybe retrenchment. And I would say that you have to be well prepared in terms of change management training for you and also the organization, so that you follow a process that is actually humane, a lot of empathy, and also a balanced kind of a process whereby there's a lot of negotiation and also interaction with the impacted employees. We tried our best to try and keep the employees in spite of the business going down. Of course, we had also a global strategy around restructuring, but that was not as a consequence of COVID. But I would say that as an organization, we've tried our best because we believe very much that the COVID situation is a transient kind of situation, which hopefully in the next few months or so should wear off, and we should start getting back to the normal business operations.
There's been a lot of debate, first of all, internally, among all the Jubilee companies, okay? And the board also. And we said, and I'm proud of the decisions the board supported us on, is any layoff of staff will be a last resort, or any pay cuts for that matter. And I'm proud to say Jubilee has not reached that point yet. And it is unlikely we will reach that point. I don't see us reaching that point unless there's a total catastrophe. Because what we did was we rallied our staff that if we serve our customers and our customers are able to stick and we sustain the business of our customers, there will be no need for those drastic measures.
The disruptions in business meant that they needed to be agile and adapt to the ever-changing COVID-19 environment.
As Sanofi, just like other pharma companies, our first reaction was to try and find a solution because this is our call, this is our purpose, and we had to adjust to try and find a solution. And that is why you've seen a lot of activity around development of vaccines. I will say that currently we have 2 vaccines that we're working on as a company. They're still under clinical trials, and we expect them to be out at least in the second half of next year. Hopefully, I think that will also address partly the challenge that we are faced with the COVID. Now, on the second part, we as a company also reacted in a way that we ensured that there is continuous flow of medication, because besides COVID, we still had other diseases such as diabetes, hypertension, and we need to ensure that there is continuous flow of these products even during the lockdown periods. So our factories, actually, we were very strategic in trying to make sure that people work in different shifts, and the productivity or the production of these products was smooth and uninterrupted.
The covers that we have are based on a set of defined benefits based on a certain premium. And it's good to also note that NHIF does not get funding from the Exchequer. It's members' contributions with our defined benefits, and then we ensure that members have access to those benefits. Now, in the case of a pandemic, like in this case, there are a couple of reasons that make any third-party payer not be able to pay. And number one is that it is new and global. Number two, you do not know the extent that it will go to, both in terms of scope of the disease or even in terms of the expense of the disease. But more critically is that when you have insurance, you have made a promise that you as my member, that you've paid a premium, that you'll be able to go to our providers and get service. Now, in the case of a pandemic, even the providers might not exist. Like if you remember the time of Ebola, and even now as we're looking at the effects on the healthcare workers. So if you have an insurance and you cannot deliver the service, then would be in breach. And that is why in the case of a pandemic, it is not usually paid for. However, with time, after you learn how the disease is behaving, then you can model and actually have premiums or funding to be able to. And that is what we are doing right now. And we have certain covers like, for example, the group life that also caters for COVID. And we are looking at getting funding to be able to support the patients who have COVID on a regular cover. But that is something that would have to model. And I would actually take you back to HIV. At the initial phase of HIV, nobody was covering. But after we learned that the disease can be managed in a certain way, the modeling was done. And right now, it is fully covered like we also do with other chronic illnesses.
We were able to support them. And we worked out mechanism, first of all, if you have lost your job and you can't pay your premiums on time, we worked out mechanisms with financial institutions so that you can continue paying as time goes by. But unfortunately, some of them had to break the policies, what we call insurance surrenders. And we were able to advise them and say, you can take a break, first of all, or in the event that you want the money, when your financial situation improves, please come back.
More than that, I think we were concerned that what next? I think it was the fear of the unknown initially, that what are we doing? But I think we quickly put up systems because we have a fantastic satellite center at the Village Market Mall. So we were able to divert patients because I personally was getting calls from patients that, do you have COVID patients in the hospital? Because we want to come for our lab tests. So we were actually able to divert the patient volumes to our Village Market branch. And I think they were able to get that level of treatment there. But certainly, I mean, you really worry that patients who really wanted that care at that moment in time were actually making a personal call not to come to the hospital.
Like a driver on a bumpy road hitting a pothole, the question lingering at the back of one's mind is, what next?
What kept us going was our business continuity plan. We made a plan and we said that these are the things that we are going to do. For example, we decided to embark on many initiatives, telemedicine being one of them, pharmacy on wheels, lab on wheels. We were doing online CMEs. So there was something that we were doing. I'm actually very lucky to be part of a team that is so dynamic and innovative. And we were able to come up with so many creative mechanisms to be able to reach out to patients. And if they can't come to us, we can go to them.
There were two things that led us to prepare well. One was business continuity. Our customers should not suffer. So we started asking ourselves, who are the people who are likely to be disrupted and what kind of support would these employees require? So we were very much concerned about that. Then the other one was safety of our staff. Okay? So we began by fumigating all our offices across the country, beginning with our headquarters here. And then looking at the safety protocols, sanitize, where would we get masks? So we had to install sanitizers everywhere. And then also teaching staff the new protocol, because it required acquiring of new habits. Initially, people used to ignore checking of temperatures, and we made it compulsory, and we actually check. Then we disabled our biometric clocking system, because then that will be a touch point, because then the system was such that you could not authenticate staff by biometrics. So we did a lot of overhaul of our procedures. Even, for example, if you look at the design of our offices, the original design is still here, but our staff will not be close, even when they come back. We will have redesigned the office so that then the social distancing aspect still remains.
The team spirit that we've had, which has been very positive even during this difficult period of time. I would say also in what we stand for and what we believe in as an organization, we serve the people, we serve the community, and it's our duty to try and help or fight any diseases that the community is faced with. And we recognize the importance of us ensuring that our services are continuously provided even during the difficult period, and that's what we did as an organization. I will also say that one of the things was the agility and ability to adapt to the situation that was very difficult. That's embracement of the digital or using the virtual kind of communication to be able to keep the business flowing or our activities going. So that really helped us and it made us stay afloat. I would say we are among the early adapters in Kenya in terms of digital deployment, and it made a big difference for us as Sanofi, as an organization.
COVID-19 was like a classroom in life. The best thing to get out of the crisis was to pick lessons that would propel the business forward.
I remember one statement made by Jack Ma. He said, during the pandemic, survival is profit enough. Okay, make sure that the company stays on a tight ship and survive through. So what we have done as Jubilee is to control our costs, okay, and we have aimed at 20% reduction in cost through just higher productivity and efficiencies, and I can say we are largely almost there.
COVID also taught us quite a number of things, and in the issue of restoring trust and being transparent, we enhanced our digital tools. So for the first time now, even for capitation, our providers and our members are able to select providers digitally, and that is the way we're using to even pay for capitation.
I remember when the first customer, I think, I can't remember what patient it was, but they were among the first, okay? They were among the very first. And there was no policy on how to handle COVID patients from an insurance perspective. But we were able to discuss with the patient and the hospital. And we learned a lot that actually there was little the hospital was doing. We were giving you paracetamol just to keep your temperature low and any opportunistic pain. But that was it. So we learned that the major cost was dormitory costs. So that enabled us to review policy on dormitories. Okay, a patient is just sitting there. The hospital can do very little. It's just managing the virus.
As Kenya starts its second year within the pandemic, the lessons for these CEOs will extend beyond 2021.
We will continue with a lot of the things that we are doing now on the online working and working from home. We also do monthly staff interviews and surveys on what's the experience from work from home, and we have gotten a lot of feedback. Many of our staff don't have appropriate workplaces. We have learned that. Some of them, even at the initial stages, they say they don't have an appropriate seat from home because, you see, dining on seat, for example, is meant for half an hour, 1 hour. But you have now to sit on the same seat, very hard seat, for 8 hours. And that created challenges. And we got the feedback from our staff. Some of them had to learn how to use online applications like Zoom or Microsoft Teams, and all sorts of noises in the background, you know. And then also, we had to synchronize our telephone system with employee mobile phones. So if a customer calls in on our general line, that call is directed to a member of staff working from home using their mobile phone. So a lot of things were reconfigured. Initially, a lot of calls were dropped, but staff got the hang of it. And now you find that 90% of our phones are now picked by staff because they know, they can see that's a call from the office, and we monitor that. So when we put in place the monitoring tools, there was great improvement. Then, of course, there were delinquent employees who were not doing their job as required. So we put an app, so that a timesheet. So this timesheet, at the end of every month, you tell us exactly what you did, okay? And it's for those staff who we cannot measure what you are able to do.
I think the biggest lesson from a personal level and also maybe from population level is the importance of vaccines. Remember, all the situations that we are faced with is just the fact that we didn't have one vaccine. So there are many diseases that we are vaccinated against, and we never think about it, but just imagine we did have vaccines for those diseases, our lives will be totally disrupted. The other big lesson I think that we can carry to 2021 is the fact that digital adoption or virtual kind of interaction has impact, just like maybe to some extent, just like face-to-face impact. So there are areas where probably you need to weigh whether you really need to have a face-to-face kind of interaction or maybe adapt or use virtual kind of adaptation. Now, from a business perspective, there's possibility of cost saving because maybe you don't have to fly or to travel extensively. You can also deploy the digital kind of engagement, which is impactful, effective, and still gives you the same or better even outcome.
With a vaccine around, the future might start looking up for better days.
I was ready for that perfect vision.
We always work as a team and we always see each other. So that personal touch was something that was a big concern for me because it really plays a key role in terms of motivation, in terms of teamwork, in terms of a positive spirit at work. But now people working at home, far from each other, that was missed significantly, and that was my big concern.
At the personal level, you always get challenged, with COVID, reminding yourself of the health protocols, reminding also yourself that you have to provide a good example, not only at family level, but also at work level, and making sure that you minimize a lot of the risk that you would go through. So one of the things I had to make a decision on is, should the command center of the organization be in my house or in the organization? And I chose to come to the office. Even when the rest of the staff were out, I said, the command center needs to be right in the office. And it was a good decision. In hindsight now, it's saying, yes, it kept the organization knowing that the general is in the front line and making sure that things are okay.
Thank you for watching Health Digest. My name is Dr. Mercy Korir. Be safe and God bless.